5 different specialists, 5 different diagnoses, 0 solutions. Sound familiar? Hey everyone, I'm Dr. Arturo Lizano. I'm a functional medicine doctor, and the first question I always get is, what is functional medicine? Most people have never heard of it, or if they have, they think it's some kind of holistic medicine only for people with lots of money or some alternative approach. And I wish more people knew that functional medicine is for everyone. Functional medicine should be how we approach health for everyone. Let me explain why. So what is functional medicine? Think of it this way. Conventional medicine asks, what disease do you have? Functional medicine asks, why did you get sick in the first place? When you go to a conventional doctor with fatigue, they might run some basic tests. And if those come back normal, they'll tell you you're fine. But functional medicine will ask, why are you tired? What's happening in your body that's making you feel this way? We're not just treating symptoms. We're looking at everything. Your sleep, your food, your stress, inflammation, toxins, the whole picture. It's about finding the root cause of the situation. Here's the thing, your body is incredibly smart. Before you get a disease, your body usually gives you signals that something's off. Functional medicine helps us catch those signals early. Most chronic diseases don't just appear out of nowhere. They develop over time because one or more of our body systems aren't working optimally. And here's what's really neat. When we fix those underlying imbalances, we often prevent multiple diseases at once. Let me give you a perfect example with inflammation. Here's one single problem that can disguise itself as totally different diseases. If you have chronic inflammation, it might cause depression in one person, arthritis in another, diabetes in someone else, or even cancer. Same root cause, different symptoms, different diseases. Or let's flip it. Obesity, most people think it's just about eating too much, but obesity can actually come from inflammation, hormone imbalances, genetics, yes, food and exercise, but also mood disorders, stress, poor sleep, or toxin exposure. See how this works? It's not one symptom, one pill. It's understanding the connections. The Institute for Functional Medicine, for example, teaches us 6 core principles that guide this approach. First, gene-environment interaction. Your genes and their environment interact. You're not stuck with your genetics. How you live influences which genes get turned off or on. So even if diabetes runs in your family, your lifestyle choices can determine whether the gene ever gets activated. Second, upstream focus. We address problems upstream. Instead of just blocking symptoms with medications, we fix what's causing the problem in the first place. It's like fixing the leak in your roof instead of just putting buckets on the floor. Third, systems biology. We see your body as a web of connections. When one thing goes wrong, it affects everything else. When your gut affects your mood, which affects your sleep, which affects your hormones, we see all those connections. Fourth, multimodal treatment. We attack the problem from all sides, not just one pill, but nutrition, movement, stress management, sleep optimization, whatever your body needs. It's like cooking a great meal. You need the right ingredients working together, not just one magic spice. Fifth, patient in context. We look at your entire life situation. Your health story includes where you live, your stress levels, your relationships, your past experiences. Everything matters. Because what's realistic for a busy executive might be impossible for a working parent, and that's okay. And sixth, patient-centered care. You're the expert of your own body. We work together to find what works best for you, not what works for everyone else, because you know your body better than anyone. I'm just here to help you understand what it's telling you. In my practice, this means when someone comes to me tired, we don't just check their thyroid. We look at their sleep quality, their stress levels, their gut health, their hormone balance, their nutrition. When we find that their fatigue comes from poor sleep, which comes from stress, which affects their hormones, which impacts their digestion, now we have a real plan. We fix the sleep, manage the stress, support the hormones, heal the gut, and guess what? They don't just feel less tired. They feel better than they have in years. That's functional medicine. It's not complicated medicine for complicated people. It's smart medicine for anyone who wants to understand their body and feel their best. Because you deserve to know why you feel the way you do and what you can do about it.